September marks National Pain Awareness Month, and we're familiar with that here in Arizona because we have an opioid, if I'm saying that right, epidemic here, and our own governor is very concerned about it. So there's a lot of movements and a lot of information out there about alternatives to narcotics and other types of medication. And today we have Dr. Ravi Chandiramani, who is the co-founder and medical director of Blue Door Therapeutics, to talk to us a little bit about some alternative ways or some medications out there that are way better for you and more helpful than narcotics and opioids and other medicines.
Absolutely. Good morning. Thank you for having me.
Yes.
Some of the things that have been used, some of these things have been used for centuries. They've been modernized, and what we find is that a good amalgamation of these things that have some evidence behind them can be really useful alternatives to things like the more dangerous opioids. For example, acupuncture. Centuries old, a lot of good evidence out there. Most of the evidence would say it's really useful in the management of chronic low back pain. Also massage therapy, yoga, cognitive behavioral therapy, which is traditional talk therapy.
Oh, okay.
Exercise as well. All of these things have some moderate efficacy in the treatment of chronic low back pain. And then one of the things that we do at Blue Door, we're kind of, part of our clinical expertise is really in the judicious use of medical marijuana or cannabis in the treatment of pain disorders. And there too, mounting evidence that when cannabis is used in the treatment of chronic pain management, getting some really good results, reducing that pain level, improving pain and functional outcomes as well.
And you know, medical marijuana seems to be getting a foothold across our country. Many states have legalized it. Arizona is one of those.
Yes.
What else do you do at Blue Door? Do you, and I guess I should back it up by saying, do you have a doctor there that prescribes the marijuana, or are there people there that do acupuncture, that do the yoga, that do these other alternatives?
Absolutely. Thank you for asking the question. What we find is, including as many of these services under one roof makes it as easy and convenient as possible for our patients. So indeed, we offer acupuncture on-site, massage on-site. With regards to the cannabis, we're not actually prescribing it, but rather, if a patient's a good candidate, we'll certify them so they can participate in the state's program and have access to it. And then on-site, we have cannabis coaches, which is kind of a novel role.
Yeah, I haven't heard of that.
Right, it's kind of a 21st century, paramedical or paraclinical role, where these individuals have a wealth of knowledge and experience in the use of cannabis and can advise patients on the best use, the best strains, the best routes of administration, et cetera. So it takes a lot of that guesswork out of it.
So it sounds like over at Blue Door Therapeutics, if a patient were to come in and they could say, look, I'm suffering from low back pain, you're really a one-stop shop because you can talk to them about the different things that are available to them and actually offer it to them.
Absolutely right. And we don't market ourselves as a pain management facility, but rather as a facility that specializes in getting people reduced and or off opioids. And these are the various ways that we found help in that process.
That sounds like a place that is really filling a need that Arizona needs in many places across the country. Thank you so much for joining us today. That's excellent information. If you are interested in Blue Door Therapeutics and the alternative pain solutions, go ahead and visit aztv.com.